Hi, this is Julian. I'm a chiropractor here. For those of you who don't know, at Adonis, I'm here on the Wednesdays and the Fridays. If you ever have any questions and see me around, feel free to ask. But today we're going to be talking about low back pain or back pain in general, and whether you should be potentially taking a break from training, backing off, or whether you might be okay to kind of try a few things to loosen it up and keep going with your training. Back pain is quite a common occurrence in people who train and people who have a sedentary lifestyle. If you're training, obviously it's going to be quite important. Use your back to transfer weight through a lot of exercises, such as your deadlift, your squats, pretty much really anything. And injuries do tend to occur from time to time. So most commonly, people might get a little bit of a twinge in their back when they're squatting, when they're deadlifting, and they might be unsure of whether it's something that they can keep training through or whether they should take a little bit of a break and maybe see somebody about it. So first of all, if you do feel a little bit of a twinge and you're in the middle of the set, I probably would stop that set, have a bit of a rest, take a little bit more time than you normally would in between sets, see how it feels. If that pain does start to settle down, you can give it another go. Otherwise, we're going to go through a quick exercise here. So I've got Ken here who's going to demonstrate the exercise. We're going to go through cat camels. Some of you might know them as angry cats, happy cats, whatever you know them as. They're a really great exercise just to get your back moving, see how it feels through that whole range of motion, and also to loosen up any kind of muscle spasm that you might have. So we'll get Ken down onto the ground. So what you want is you have your hands roughly under your shoulders, knees roughly under your hips, and we're basically going to go and flex through the whole spine and then extend through the whole spine. So from here, he's just going to be pulling up in through here, all the way up into the roof. So bending up in through here. And as he does that, he's going to tilt backwards through his pelvis as well, which is just going to round out the lower back. In this position here, it's a very safe position. There's not any kind of load going in through the back. So he's going and flexing all of that. As he's doing that, getting a bit of a stretch in through the lumbar spine and all the muscles in through there, dropping the head down as well. And then the other side of that exercise is just dropping all of this down, tilting back through the pelvis and looking up through his head. So you're doing a bit of a pelvic tilt while you're doing this, doing some lumbar flexion and extension, thoracic and cervical lumbar and extension, and just going back and forth through that range of motion a few times. It's really good because it contracts all the muscles in through here, it relaxes all the muscles in through here, and you take your whole spine through the full range of motion. If you do start to get any pain or any kind of tightness, I don't want anybody to go and try and force their way through that. You just gently come up to the end of your comfortable range of motion, then gently back the other way, not forcing it through those end ranges. It's just to try and loosen the back up, try and get some of that muscle spasm to relax. So if you have been squatting or you've been deadlifting, you feel a little bit of a twinge or a little bit of just tightness, discomfort in through your back, that's something you can definitely try and see if it gives you some relief from that pain. If it does settle down, you can probably go and try and get on with your training. I wouldn't be going for any maxes or anything after feeling something in through your back like that, but that's something you can try. If that pain persists for more than a week or two, it's probably time to go and get somebody to check it. The other thing that would make me think, yes, you should definitely go get somebody to check, is if you're getting low back pain and you're getting pain down into your legs, particularly all the way down to your feet, and if you're getting any pins and needles, tingling, numbness, anything like that, definitely time to take a bit of a break from your squatting, your deadlifting, and go and see somebody about it. So hopefully that helps some of you out and you can give that a go. And that's pretty much it for today.
Hey guys, welcome to Just a Tip. Today I want to talk about testing strength for people that compete in